37 active cases. Yesterday there were over 7,000 tests, and our total number, 7,000 tests, and in relation to the vaccine we have in total 21,861. So in relation to the PA doctor, can we say a few things about that? So out of the 400 contacts that we have, 58% are negative so far, which is wonderful news. Now, because we had the incident at the Hotel Grand Chancellor, and Dr. Bennett will talk a little bit more about that, we will be extending for another 72 hours those provisions we have put in place across Greater Brisbane. So that applies to the hospitals in Greater Brisbane, the aged care facilities and the disability services. So we will be able to update everyone on Friday, and fingers crossed it'll be good news, and that would then mean on the weekend people would be able to go and see their loved ones. So we're just asking the community to be patient for another 72 hours just whilst we finalise all of this data and get the test results in. In relation to issues I discussed yesterday about Papua New Guinea, I had a discussion with the Prime Minister last night. We'll be speaking later on again today, and we had a very good discussion, but I'm not going to go into any further details until I get an update later on today. But I can say that both the state and the federal government are treating the issues of infections in Papua New Guinea very seriously, and I just want to reassure the Queensland public that I said yesterday that I would speak with the Prime Minister, and I did that. So today it was great to come down here and see Zoe and the amazing staff here at the Gold Coast University Hospital. And we also have with us Dr. Gerard, who will be speaking with you. And of course, he was one of the first doctors that were treating the COVID patients that first came to this hospital about a year ago. And how far we've come in a year. So today Zoe received her second vaccine. We hope over the next 2 weeks we will complete the first dose of vaccination for that 1A category and be able to move on to 1B. And of course 1B is both Commonwealth and state responsibility as well, and it does depend on the dosage that we receive. So look, that's wonderful news to see Zoe and the other people who are police officers, frontline health staff, now getting that second dose of the vaccine. So look, I'll hand over to Dr. Bennett, then we've got Dr. Gerard and the Health Minister, and then we're happy to answer a few quick questions. Thank you.
Thank you. Thank you, Premier. Good morning, everyone. As the Premier indicated, with respect to the healthcare worker at the PA, we're feeling very reassured about those circumstances and how they're unfolding. Both the Hospital and Health Service has contacted over 1,000 people to determine whether they're contacts or not, and as the Premier said, those that have been determined to be close contacts, with 58% of those have already tested negative. So that's really good news, and we're very reassured by that. But with respect to the Hotel Grand Chancellor incident, we've still got some information to work through, and those events are still unfolding. So yesterday what I can tell you is that all the staff who worked through that period of risk from the 5th to the 9th of March have been tested yesterday. All the guests who have left the hotel since the 1st of March have been contacted as well and requested to isolate and get tested. And then those guests who are still in the hotel, who had their quarantine period extended for 72 hours if they were going to leave, of those guests we will need to require those who stayed on level 1 during that period of risk will need to have their quarantine extended for 14 days from the 9th of March, unfortunately. But for all those others, a decision will be made tomorrow. As we said, we had the hotel in lockdown for 72 hours. That finishes tomorrow at midday, and a decision will be made based on the results that come in from all the testing that's being done about what the risk is and whether those other guests can be released if they finish their quarantine period. So as far as a review of the incident goes, the CCTV footage hasn't shown any clear breach of any kind. Nothing significant, and I note in the media as well that we've seen something similar in New South Wales, and I think that just indicates the smallest things. This is a highly infectious virus, particularly in some people. You've heard the term super spreaders, and I think what we mean when we say that is that some people very readily transmit the virus due to a number of factors, not just any one. So we have not as yet identified any significant breach, but that'll keep being reviewed. But the most important thing is the public health work and the follow-up, which will continue. I do just want to mention the New South Wales quarantine worker case as well. So we are asking all Queensland residents or people who've come to Queensland from New South Wales, please, if you've been in New South Wales recently, please check their website for the information about their locations of risk and call 13 Health if you need advice, and we need you to follow that advice, particularly if you've been in any of those areas of exposure. So I just ask Queensland residents to do that, or anyone in Queensland who's been in Sydney during that risk period. Thank you very much, and I'll hand over to the Minister.
I want to thank Dr. Bennett and her team, who have been doing a tremendous job over the last 72 hours in contact tracing, testing and getting these results, and managing the PA incident and also the Hotel Grand Chancellor. The results so far are very reassuring. In relation to the vaccines, we are very excited to be back here 3 weeks on from our first vaccinations in Queensland, which started here at the Gold Coast University Hospital. And Zoe, who was our first patient to get the vaccination 3 weeks ago, has now got her second jab. Registered nurse working in the COVID ward. So we want to congratulate Zoe, but I want to congratulate all of the health staff who are working here in the vaccination centre and across the hospital. There's just over 10,000 staff at the Gold Coast University Hospital, and I've been advised this morning that over 6,000 of those staff have already had their first vaccination. And in fact, when it comes to Phase 1A, Gold Coast University Hospital has completed their 1A group for the hospital staff for their first vaccination. Now, there'll always be some lag, people who were sick or people who are on leave, which we always intend to pick up in 1B, but realistically, we've done all of those staff, which is fantastic, and they're moving on to 1B group already here at the Gold Coast. So that's really exciting news. On the first day here, they did 203 vaccinations. Now they're hoping to do 3,000 this week. I can advise that as of yesterday, we did 3,067 vaccinations in a single day across Queensland. This brings us to 21,861 vaccinations. So this is really exciting news and puts us on track to have all of our Phase 1A group vaccinated for their first vaccine within the fortnight. All of 1A for their first vaccine within the fortnight. We're standing up another 14 sites this week on top of the 17 that we already have, and we've got not only Pfizer being delivered but also the AstraZeneca. As I have said, there has been a lot of fluctuation in the delivery of our vaccines. I've just been hearing at the Gold Coast University Hospital here that we had vaccines coming, then we were told they weren't coming, and in fact, in the last hour, we've had a delivery. So we have to quickly adapt to make sure that we can utilise the vaccines that have come in, and I want to thank all the staff for doing that. So over our first 3 weeks, our first week of vaccines was 2,030. The second week, we delivered 6,270, and in the third week, we delivered 10,405 vaccinations. That shows that we are rapidly increasing the number of vaccinations being delivered across Queensland. We are on track to finish 1A in a fortnight for the first vaccination, start on 1B, and our target is to have the state government's implementation of vaccination for 1B finish around mid-June. So the rest, of course, in 1B, which is around 70%, will be the Commonwealth's responsibility, and they're working through that with GPs and also with pharmacists. I'll now hand over to Dr. Gerard.
Thank you very much, Minister. So as you've heard, we've vaccinated 6,308 patients to date here in the Gold Coast University Hospital Hub. Our hub is progressing very well. The whole vaccination program here is progressing very well. We are planning to increase the rate of vaccination this week from 2,000 per week to 3,000 per week this week, and then we'll look at what happens beyond that date. As you've heard, we have now completed the entire Group 1A within the health service. Now that doesn't include residential aged care and their staff who are handled by the Commonwealth. But all 1A, Group 1A outside residential aged care we have now completed. If there is anybody out there who believes they belong to Group 1A and for some reason they haven't received vaccine, they should contact their line managers immediately and we will offer them vaccine immediately. So there should be no one left in our health service unvaccinated. The vaccine supply has been tight. We were a little anxious yesterday that we might run out of vaccine, but thankfully we received additional supply about an hour ago, and so we can continue with our plan to increase the number of vaccines given this week to around 3,000. We no longer allow staff to enter the rooms of any patients with confirmed COVID-19 unless they have received at least one dose of the vaccination. So it is no longer permitted for any staff member to enter the room of a patient with confirmed COVID-19 unless they have started the vaccination program. We are now moving on to 1B. Now, many people don't appreciate that there are many other healthcare workers that are required to see COVID patients that are not so obvious that belong to Group 1B. For example, we've seen quite a number of women during pregnancy who have active COVID-19. So we need to ensure that our midwives and obstetricians have been vaccinated against COVID-19. We have seen a number of patients with mental health issues with active COVID-19. So we need to vaccinate our psychiatrists and mental health staff. And that's not obvious to those who don't work in a health service. We've had a patient with suspected appendicitis who has had to see a surgeon and an anaesthetist. So we are actively vaccinating our surgeons and anaesthetists. So we expect that within the next 2 to 3 weeks, all of the healthcare staff here at the Gold Coast University Hospital will have received their first dose of vaccine. That will allow us to create a bubble here at this teaching hospital, which will prevent any introduction and transmission of the virus within our hospital. And we're very happy and confident that we're able to do this, provided we continue to receive supply from the Commonwealth. For us, we are using the Pfizer doses. We are supplied with Pfizer vaccine. We are a Pfizer hub. AstraZeneca is given in other locations.
Thank you. Any questions for myself or Dr. Bennett or the Health Minister? I'll get the Health Minister to talk about that, but as we said, our priority has always been on 1A at this stage. Now in 1B, which is the elderly adults aged 70 and above, that's the Commonwealth's responsibility. So the Commonwealth has been talking to the GPs to get a network to administer. And don't forget, that's a large bulk of 1B. And then we will be looking at the critical and high risk other workers, including like police, our fireys, our emergency services, and National Cabinet also agreed on the meat processing. So look, this is a vaccination program where we are working with the Commonwealth, but the Commonwealth is responsible for the majority of the vaccine rollout, and the Commonwealth is responsible for providing us with the supply of the vaccine. So what you've seen the Health Minister say today is that it is being ramped up. It was always the intention to ramp up our delivery, but there is a proportion that is for the state to administer, and there is a proportion, which is the largest proportion, is for the Commonwealth to deliver. So we said we would be updating Queenslanders every week, and that is exactly what we will do. Well, I'll let the Health Minister talk about that, but it's in terms of if there is dosage left over. You can't waste the dosage, so if people are available, you will administer that dosage. But I'll hand over to the Health Minister.
So could you just repeat the question? So in all of our hubs, we are continuing to roll out 1A, and we will have 1A completed. Our target is having everyone in 1A done within a fortnight. So everyone in 1A will be done within a fortnight for their first vaccination. So no one is having to miss out so that someone else can get a vaccination. It's really important for people to understand that. With the Pfizer vaccine, we have to defrost it, and then we have to dilute it. Once it's diluted, and this comes in a vial where the Commonwealth has factored in that we use 5 doses out of every vial. We've been very fortunate, and in many cases we've got a 6th dose out of those vials. Now, at the end of the day, that cannot be held over to the next day. It must be used within 6 hours of being diluted. We are not going to throw any of this in the bin. So if we have any left over at the end of the day, what our hospitals are doing in our vaccination hubs is finding other hospital staff, and they're giving them that vaccination. Remembering, every single hospital staff, no matter what job you do in the hospital, is part of 1B, and we need to vaccinate all of them. So that is what is happening, but no one in 1A is missing out or having their booking cancelled to give it to someone else. They're all arriving, they're getting vaccinated, but we are having some excess at the end of the day that we're making sure we don't throw in the bin. Every state and territory is doing this, and the Commonwealth is doing this in aged care as well. It is making sure we don't waste this at the end of the day. So whoever's available, who can get this vaccine at the end of the day so it doesn't get thrown out, then they are vaccinating them if they work in a hospital. Every state and territory is doing this, the Commonwealth's doing this as well. I'd much rather see another health worker getting the vaccination than see this wasted. So all of the staff will get their vaccination. Our aim is to have our responsible group in 1B, all of the health workers, emergency workers, done by mid-June, and that's what we are on target to deliver. Look, it changes. We've just heard within the last hour, we've had, I think, 6,000, I'll check that with Dr. Gerard, 6,000 doses arrive within the hour. Now, last week I was being told these trays weren't going to be delivered, but it's arrived in the last hour. So it's changing daily as to how much Pfizer and AstraZeneca we have. So we are having to adapt so quickly. That's why we've stood up an extra 14 sites this week. But we are rolling this out as planned and making sure that we can continue. Because as we've just heard, there was real concern yesterday that the Gold Coast University Hospital would stop vaccinating today if this delivery didn't arrive this morning. So we have to make sure we've got enough supply that we can keep the process going and we're not stopping and starting. No, so as each vaccination hub completes their 1A group, they can move into 1B. But as we know, all of that will be completed in the next fortnight. They'll all be through their 1A group. And of course, the 1A group will keep coming back for their second vaccination. But while they're doing that, we'll start with the 1B group. 37,000. Yeah. So it's rapidly increasing every day. We're really excited about the targets. By mid-April, we hope to be delivering 20,000 vaccines a week. So that's what we're aiming for, moving up to 20,000 a week by mid-April. And nationally, the target is that once CSL start delivering 1 million vaccines a week, which is the Commonwealth, which is what Greg Hunt has predicted, 250 vaccinations should be delivered here in Queensland each week. Now, the majority of those, 2/3 of those, will be delivered by the Commonwealth, and the state will have the responsibility of about 1/3. But the aim is to ramp up to 250,000 across the state once we start getting 1 million vaccines a week across the country from the Commonwealth. So we're not there yet, but where we are at, based on the numbers we're getting, is we're going to be able to be doing 20,000 a week by mid-April. Well, as I said yesterday, we're very fortunate here on the Gold Coast. 1A's already done. So they can take the approach, and every hospital will do this as well. As they get all of their 1A group fully vaccinated, they'll be able to say them and them alone should be the ones working with COVID patients. But at the moment, if we were to take that approach, half of everyone who works with COVID positive patients or at risk of having COVID, hotel quarantine staff, border control, paramedics, police and hospital workers, if we were to take away all the ones that weren't vaccinated, we'd have a significant shortfall of staff to manage, and that would make it unsafe and it would significantly increase the risk of transmission. We're not going to put the community at risk by significantly reducing the workforce. Let's get the vaccine done. Let's get on with it. That's what we're doing. And we're very proud that within the next fortnight, I'll be able to stand up with the Premier and say 1A is done. When? Well, we know the Commonwealth has set a time frame for the end of October. Now, let's be clear. Realistically, that's for the first dose, not for being fully vaccinated. We are seeing around the world, I don't think we've got to 1% of the world population yet that is fully vaccinated. This takes time. So we are working to the Commonwealth's target of having every Queenslander that is eligible vaccinated with their first vaccine by the end of October. That's the target we're working towards, if we get the supply. That's right, Premier. Whatever Dr. Young says is available and we should have, but whether it's Pfizer or whether it's AstraZeneca, they both have been approved by the Therapeutic Goods Administration. They have both been deemed safe. They are both being rolled out across the country, and I would be more than happy to stand up and get either of these vaccines when my time comes. I am, and if you want to ask any questions about those concerns, I'm happy for Dr. Bennett to speak specifically to those issues, because I think that's important for the public to understand about those.
Yeah, I think it's important to say, with respect to the concerns about AstraZeneca that are in the media at the moment, it's reassuring to see what Norway is doing. That shows the system is working. They picked up that they've had 4 cases who've had some sort of blood clotting disorder, which was associated in time with the vaccine, and that's exactly what any system needs to do. They need to review what that means, what that signal means, to make sure that it isn't associated with the vaccine. Just because something happens temporarily in time with the vaccine, it's not necessarily associated. So it's important to note that. And it's also important to note that the UK, who's probably distributed far more of the AstraZeneca vaccine than anyone, hasn't seen that particular signal. So every country is monitoring for safety and adverse events, and that's as we all should do. So it's good to see that happening, but the evidence, as I understand, also shows that clotting disorders happen for a range of reasons in people, unfortunately, and that the number that has been seen associated in time with the AstraZeneca vaccine doesn't appear to be any higher than what we would expect to see in the community. So I think we can be reassured that the process is going on, and also reassured that the vaccine is safe.
That's not for us to do that. As I said, look, I don't want to say anything more. I had a very good conversation with the Prime Minister last night, and I'll be speaking with him again further today. But we are concerned that over 50% of our active cases in Queensland at the moment are from Papua New Guinea. That's our concern. Sorry? I think they were starting yesterday. Yeah. No, we can get that. We can get back to you on that one. Yeah. Sure. Like the Health Minister said, I am more than happy to receive either of the 2 vaccines. Whatever Dr. Young recommends, we're happy to take. Well, I think everybody needs to realise that that vaccines work, and the best way we can get back to normality is to have as many people as possible vaccinated. And we want to reassure the public about that. You saw young Zoe today having her second vaccine. Dr. Gerard's had his first, and the Health Minister and I and Dr. Bennett will have our vaccine at the right time as well, to also make sure that there's that confidence in the community to get the vaccine. Well, we just have to, because there will come a day eventually when our borders will be open and we will need to be vaccinated against this disease. Sorry, Greg, I just can't hear the question. Well, I was just up there today, and there was obviously a line of people that knew they were getting their vaccines today. And what is very important is that we get the supply from the Commonwealth. So we can administer the dosage, but we need to make sure that we have got certainty of supply. And that's not just unique to Queensland. That's an issue that all different leaders have been raising with the federal government. Look, I'm going to leave those conversations until after I've spoken further, but we know that there are increasing number of cases in Papua New Guinea at the moment, and any additional support that the federal government can give, whether it's vaccinating healthcare workers up there, ensuring that their hospitals are safe, there's a whole range of measures. The Commonwealth Government has been very good in this space. They've often reached out at times of need of our Pacific Island neighbours, and I don't think that they will ignore this situation. It's right on our doorstep. Papua New Guinea has very close relationship and ties with Queensland and Australia, so of course I think it'll be a two-way street of wanting to make sure that we work together on this. Look, that's a matter for the Commonwealth at this stage. All right, thanks everyone. Yep, last one.
No, as I say, it's only where either completed the 1A. Not surprisingly, Gold Coast University Hospital was the first site to start, so it's of no surprise they're the first to finish the 1A rollout, and they're moving into 1B. The only other 1B people is, as I say, if at the end of the day it's either throw it in the bin or use it on another hospital staff member. That's what we've done. And of course, we've started rolling out into the Torres Strait, so that's a 1B group. I don't have the specific breakdown yet, but importantly, I'm also not getting hung up on the numbers between 1A and 1B, because in 2 weeks' time, 1A will be done, we'll be into 1B. That's our priority right now, just getting that rolled out. Thank you.